Accidents can occur unexpectedly, making basic first aid knowledge essential. First aid knowledge can be life-saving in critical situations. This presentation will cover 10 life-saving first aid tips. First aid demonstrations provide practical guidance for managing common injuries and medical emergencies. Properly applying pressure and tilting the head forward are key steps in managing a nosebleed. Concise, step-by-step demonstrations ensure effective learning and retention of first aid techniques. Demonstrations will cover various first aid techniques for different scenarios. Techniques include treating minor burns with cool water and sterile dressings. Other techniques include assisting someone who is choking and applying bandages to wounds. If a fishbone becomes lodged in the throat, avoid swallowing large pieces of food. Swallowing large pieces of food can push the bone further down the throat. Pushing the bone further down can make removal more difficult and potentially cause injury. Drinking vinegar is not an effective method for dissolving fish bones stuck in the throat. Vinegar's acidity is insufficient to rapidly dissolve bone and may cause throat irritation. It is crucial to avoid using vinegar in an attempt to dislodge a fish bone due to its ineffectiveness and potential harm. If a fish bone is visible and reachable, use tweezers to gently attempt removal. Avoid persistent attempts to remove deeply lodged or difficult to reach fish bones. Seek immediate medical attention at a hospital if the fish bone cannot be easily removed. Tilting the head backward during a nosebleed can cause blood to flow down the throat. Swallowing blood due to incorrect posture may lead to choking or nausea. Incorrect head posture interferes with the natural blood clotting process and can prolong bleeding. To manage nosebleeds effectively, a slightly forward-leaning posture is recommended. This posture helps keep the airway open, preventing breathing difficulties during the bleeding episode. The forward-leaning position also aids in the observation and treatment of the nosebleed, allowing for better visualization and access. Pinching both sides of the nose firmly near the bridge is the initial step to stop a nosebleed. Applying continuous pressure for 10-15 minutes allows a blood clot to form, effectively stopping the bleeding. This method directly addresses the source of the bleed by compressing the blood vessels. For minor burns, immediately place the affected area under cold running water. Ensure the water is cool, not ice cold, to prevent further damage to the skin. Continue rinsing the burn for at least 15 minutes to effectively reduce skin temperature and minimize tissue damage. After cooling the burn, gently pat the area dry with a clean, soft cloth. Cover the burn with a sterile, non-adhesive gauze pad to prevent infection. Secure the gauze loosely with medical tape to protect the burn from further irritation. Severe burns, characterized by blistering, deep tissue damage, or extensive coverage, necessitate immediate professional medical attention. A Red Cross icon serves as a universal visual indicator for urgent medical care. Seeking prompt medical care for severe burns can significantly improve treatment outcomes and reduce the risk of complications. Upon noticing a swollen or injured foot, immediate cessation of all activity is necessary. Rest is crucial to prevent further damage and facilitate the initial healing process. Weight-bearing activities should be avoided on the injured foot. Applying ice to a swollen area reduces inflammation and numbs pain. An ice pack or a bag of frozen vegetables can be used as a cold compress. Apply ice for 15-20 minutes at a time, several times a day, to constrict blood vessels and minimize swelling. Applying a compression bandage to a swollen foot provides support and reduces swelling. The compression bandage should be snug, but not so tight as to restrict circulation. Elevating the foot above heart level promotes fluid drainage, further reducing swelling. In the event of a dog or cat bite, the immediate priority is to thoroughly wash the wound. Washing the wound with soap and water helps eliminate potential contaminants. This initial cleansing significantly reduces the risk of infection following an animal bite. After washing a wound, disinfection is necessary to eliminate residual pathogens. Iodine is applied to the cleaned wound to disinfect and kill remaining surface bacteria. Alcohol further disinfects the wound, targeting viruses and bacteria that iodine may not fully eliminate. Following cleaning and disinfection, immediate medical attention is required to receive a rabies vaccine. Timely vaccination is essential to prevent the development of rabies, a deadly viral disease. Rabies vaccination is a critical preventative measure against a fatal viral infection. Shakiness can be a symptom of hypoglycemia, indicating low blood sugar levels. Dizziness may also signal hypoglycemia, requiring prompt attention to restore blood sugar balance. Recognizing symptoms of hypoglycemia is crucial for timely intervention and prevention of severe complications. To rapidly elevate blood sugar, prioritize the consumption of easily digestible carbohydrates. 4-6 pieces of hard candy, 1 tablespoon of honey, or 2-4 crackers are effective choices for a quick glucose boost. Sugary drinks can also provide a rapid increase in blood glucose levels. After consuming a glucose-boosting food, a 15-minute waiting period is necessary for blood sugar levels to increase. If symptoms persist after the initial 15-minute period, consume another serving of the glucose-boosting food. Repeating the glucose intake is essential to alleviate persistent symptoms of low blood sugar. Begin by facing a wall at arm's length to prepare for the calf stretch. Ensure the wall is stable and provides adequate support for leaning. This initial setup is crucial for performing the stretch correctly and safely. To alleviate leg cramps, place the foot of the affected leg flat against a wall, ensuring the toes are firmly pressed. Lean forward towards the wall while keeping the cramping foot flat to stretch the calf muscle. Increase the stretch intensity by lifting the heel of the non-cramping foot. Holding the stretch allows the calf muscle to relax. Muscle fibers lengthen, reducing tension within the calf muscle. The wall stretch technique helps to quickly alleviate muscle cramps. When encountering an unconscious person, the first action is to immediately contact emergency services. Providing the location is crucial for ensuring prompt medical assistance. A brief description of the situation assists emergency services in preparing for the appropriate response. After calling for help, position the person on their side to prevent choking and maintain an open airway. Check the mouth for obstructions, such as food or foreign objects, that may impede breathing. Clearing any obstructions is essential for facilitating effective breathing. If the person is not breathing, cardiopulmonary resuscitation, CPR, should be initiated immediately. Chest compressions should be performed at a rate of 100-120 compressions per minute, with a depth of approximately 2 inches. CPR should be continued until emergency services arrive or the person shows signs of recovery. Choking is a critical emergency requiring immediate first aid intervention to clear the airway. Minor burns, cuts, and sprains are common emergencies that necessitate prompt first aid to prevent further complications. The severity of these emergencies can escalate rapidly if appropriate first aid is not administered promptly. The Heimlich maneuver is applied to dislodge obstructions from a choking person's airway. Burns should be immediately rinsed under cool, running water to reduce tissue damage. Cuts should be cleaned and bandaged to prevent infection and promote healing. Maintaining composure is crucial in first aid situations. A thorough assessment of the situation is a critical first step. Seeking professional help is essential when needed. The phrase, "Want more health and safety tips?" is displayed in a prominent, easily readable font. The call to action, "Subscribe now," encourages viewers to engage further. The on-screen text remains visible for several seconds to ensure viewers have ample time to read and react. An animated subscribe button appears to encourage viewer interaction. The animation is designed to be eye-catching and intuitive, guiding viewers to subscribe. Sound effects enhance the button's visibility and draw attention to the subscription action. Engage viewers by prompting them to share their thoughts and experiences in the comment section. The comment prompt should be engaging and relevant to the video content to encourage participation. Display the text, "Comment below. Which first aid trick surprised you the most?" to stimulate conversation.